So first, I wanted to introduce myself. My name is Sol Gonzalez. I am a student at Southern New Hampshire University, and I would like you to introduce yourself briefly and tell us a little bit more about how did you get started in public health and also your background.
All right. My name is Maridelis de Tres. I am assistant professor at St. Leo University. I teach public health, social, medical sociology, sorry. And I also teach public health. Um, and my background is I actually started as an anthropologist. I did my bachelor's in physical anthropology and my master's in medical anthropology. I then decided after 10 years working in public health to do a public health PhD. And
Mhm.
that was like 10 years ago when the dinosaurs roamed the world. And since then, I've been always working in health. I worked first in mental health. I work in cancer prevention, mental health for children, particularly behavioral and emotional mental health issues. Let's see. Then after that, I worked for county government. At that time, I was doing research in universities. Um, and then after that, I went to the county and worked in program development and assessment in county government. And then I spent 15 years in maternal and child health, working for a grassroots coalition that actually received money from the state. And there I was a health analyst. So I did all their data, their community assessments. Um, I did focus groups, survey analysis, and then I did quality improvement. There too, I work in infant mortality, same organization, supervised contracts. So basically, I've done all sorts of things in over 20 years of experience in public health.
Wow.
It's a long life.
Yes.
Thank God you can see my picture now and not myself, where I look much better.
So I wanted to talk about, in your own words, can you please define leadership and what does it mean to be an effective leader? Because anybody can be a leader, right? But not everyone is an effective leader, specifically in the public health field.
Sure. So leadership is not only I did supervise people, and that is what most people associate with leadership. But leadership is more of initiative, is bravery,
Yeah.
is values and ethics. Leadership is basically your willingness to listen to others and not always be right. It is also the use of evidence to support everything you do, science in particular. So a good leader is a person that is not always thinking that they're going to be correct, but
Mhm.
that they're going to actually use the science that builds their knowledge to be able to make decisions and to listen to other people and consider those other people's belief systems and behaviors. If you want to change behavior, you can't just impose things, you have to actually listen to them. And I think that's a big part of leadership that people don't quite see. Um, in public health is particularly important
Mhm.
because most of my life I work in community health. And the moment you go in thinking that you know it all and you don't give the opportunity for the community to tell you how they feel, sometimes about you and your work and your science, if you're not open to that, your projects will always fail. Part of doing needs assessments when I was before I was in academics was that you have to humbly listen to what the community needs are, which may be different from what you think they are. And a lot of times, this social determinants thing that we continue to talk about in public health, these
Mhm.
are things that other fields were doing forever. Um, Anthropology has been looking at social determinants forever. Social sciences have in general, and it just kind of filter in through science. But those communities, when they're talking to you, a lot of times they're focusing on those social determinants and trying to tell you, until I solve this, I can't do what you're asking me to do.
That seems like a really good examples. So I also wanted to ask you about the significance of leadership in public health, and how does leadership in healthcare and public health helps solve organizational or community issues?
Can you explain that a little bit?
How does leadership in healthcare and public health help solve community issues, like achieving the organizational goals or the community goal to improve health?
So how does leadership allow organizations to achieve their goals? Is that what you're saying? Well, let me see. The goals, honestly, in public health is a little hard because the goals are different wherever you go. So for example, the expectations of your funder, your state, your county, whoever is funding you, has a set of goals that are already set for you to do. So for example, if you're in a health department, although some of the goals come from the community, as you do community assessments and all of that, there's already somebody at a higher up level, you know, that is being guided for either the CDC or the feds or somebody else that has an agenda and has goals for you. As a leader, your task is to balance the high almighty goals that come from the gods above with actually your needs in that community. So leadership should be able to balance the two of them. And just to give you an example, the pandemic is a good example. So the goals were from the CDC, which were very confusing, and the county had very confusing goals. And then people at the grassroots level were trying to figure out, how do you respond to your government, your governor, your president, the CDC saying something else, and then you on the grassroots level trying to see that people were not wearing their mask. How do you get them to wear their mask? And what's even more important, how do you solve the issue that people are unable to get vaccines, people are unable to get food, you know, can't go to their providers' offices because there was a lockdown or because of fear of being, you know, of getting COVID-19. How do you handle all of the goals that were sent from above? Many of these goals did not change. So for example, the program that I was in for 15 years, and now I'm part of their committee for planning and evaluation committees, the Healthy Start Project. It's a coalition, and their job didn't change. They still had to go and talk to mothers that were pregnant, get them to care, assess the children, but they couldn't go inside of their house. So the goals didn't change. They were still expected to see this many mothers, this many children, provide this many assessments, help them with community resources, even though those community resources may not have been available for like 2 months, right? So as a leader, the way they figure it out was they Zoom visits. They asked the state, can we, you know, Zoom some visits here with the mothers? But how do you do it? Because the mothers don't have necessarily cameras, right? So you have to figure out what kind of phones they have. Can they do it? They did some dropping of resources at people's homes, you know, when they needed food and stuff like that. They had to find ways to meet the goals, and that is leadership, right? Trying to find the ways where you can meet the goals of the state, but at the same time meet the people's needs that come along. How well they did, we're about to find out, because the numbers come in every year. So we're about to find out.
So to finish, I would like you to ask about any piece of advice about leadership that you might have for future public health workers.
Piece of advice, big one, patience. Be very, very patient. Sit and wait, and it's okay to sit and wait. Think before you speak. whether you're supervising, as I did for a while, God knows how happy I am that I'm not doing that now. Thank you, academic world. I had really good people to supervise. I have not so good people. But, you know, and then you have the pressures from the states, from the goals, from the community. You have all these different pressures on you to develop that leadership and to sustain it. And the biggest thing that I would recommend to somebody is just to wait, sit, listen, and consider people's opinions when you take actions. Find the true story behind everybody's reality, right? Because they might be nasty to you right now, and it has nothing to do with you and your personality, or they just don't like you. I mean, there's people like that might not just like you, but take the opportunity to be patient and try to understand where those people come from. And I think that's the big part of leadership that is missing, that people just want to do what they're told to do or what they want to do, thinking is the correct way, but they don't put themselves in somebody else's shoes to see why the other person is reacting the way they do. So, you know, be patient. Don't wait too long, because remember, your goals are due. You know, don't be too crazy and just kind of sit there and okay. But reasonable amount of time to think and definitely think before you speak, and take other people's opinions into consideration, because you might have a PhD or a master's, but you don't live their lives, and they might have something to contribute every time.
Okay, is that everything?
Yeah, pretty much. I mean, if you're willing to be patient, kind, and listen, everything else kind of comes along. When leaders come, they usually are dropped to it. And I don't know if this is because it's my example or what, but I never wanted to lead. I never did. I knew what the consequences of leadership would be. It comes with a high price. It comes with a lot of responsibility. And it's so much easier to just be an analyst and sit there and be, you know, they tell you what to do and you do it, than to be in control of whole departments, of going to be the face of a group in a community or whatever it might be. So I never wanted to lead. It wasn't my choice. I was dropped to do it. And a lot of people are going to experience that in public health, where you do a good job, and especially when you have a master's degree, and you're automatically thrown into leadership. And you have to consider your ethics as you're doing that too, because there's certain things that they're going to tell you to do that you might disagree. And that's okay. You can disagree and still do it. The question is it ethical to do it, or is it not ethical? And that's where it becomes a problem for you to do some work. It's not whether you like it or not. There's so many things the state is going to tell you that you don't like, you know, but it's not unethical. You just don't like it. You don't like how it's being done or something like that. And that's okay. You don't have to like everything you do. But you do have to consider whether it's ethical or not. Is it based by science or not? That's where it becomes an issue. Most of the time, those decisions you might not have to do, hopefully. You don't have to do those issues, because, you know, those lead to you might having to leave the organization. But those don't happen as often. They happen, but not as often. So just, you know that you're going to make difficult decisions. You're going to have to listen, to be patient. And you might be dropped into a role you don't like, but it might be the one that you excel. And you just have to consider those things before you talk about leadership in public health. You might not be thrilled about it, but you're really good at it. You might be able to have to sacrifice for the world.
Like my mom used to say, we can do hard things.
Yeah. Sometimes we don't want to do it because we know it's hard, you know. It's not because we suck at it. It's because we know it's hard, and we know that lots of people's lives are being influenced by it. And you have to find the courage to do it, you know. And if you don't have it, then don't do that leadership role. If you don't have the courage to deal with it, definitely not. But some of us, we just don't want to do it because we know it's going to consume our lives. You know.
Yes.
And if we're good at it, we really